Hey everyone, thank you for subscribing and watching. I'm enjoying doing these short videos, more informal than my Cancer and Peace channel. And so I'm just enjoying kind of recounting and recalling, going through the cancer journey as I can best remember it. I just got back from the hospital, had a PET scan today, and those of you who have scans and tests to do, you know what it's like to have to go in and do a scan. We, in our cancer support group that I've been part of for 20 years, we call it scanxiety. But I was pretty good today. Pretty good going in. It's a nice day, and getting home and walking my dog and just enjoying the outdoors a little bit. So, just back to my story. At the point in my story where I left off, I had gotten a diagnosis locally, and the pathology was not good. It was high grade urothelial / bladder cancer. And so I knew that it was a difficult situation. And I had heard ads for a major cancer center in New York City. And I thought to myself, if I ever get cancer, I'm going to go down there. My mom had some experience down there too. And as I might have said before, she was experiencing late stage ovarian cancer. So I contacted a urologist on Memorial Sloan Kettering on a Thursday. I was in on a Monday. Turns out he was one of the best bladder cancer doctors down there, surgeons, and went down to the city, which for me it's like an hour and a half to 2 hour journey. And yeah, it's intimidating to go down to New York City, especially a cancer center, because it's all about cancer and it's tough to get in and out of the city. But I was still in shock about the whole diagnosis and just trying to grab for stuff um, that might work, and grabbing for stuff that I thought was the good next move, and trying to pray about it. And as I said, I have a higher power, Jesus, and just trying to surrender the journey to Him. But ending up in this office of this renowned bladder cancer guy, and being whisked away to do a cystoscopy, completely different experience, a cystoscopy down at Memorial Sloan. And if you don't know what that is, they insert a tube, you know where, to look up into the bladder. It's actually, it's a scope. It's actually quite nice because it's easy to get, quite nice meaning it's easy to get in to look at things rather than exploratory stuff, because images only go so far. So anyway, so he went in and he discovered more cancer than what had previously been reported. So the thought was it missed? Was it that aggressive that it had grown in 2 weeks, in a couple weeks? But I remember him saying he had to schedule an appointment, and we would discuss what he would do. And I remember grabbing him, saying, "Would you be my doctor?" Because I had trust in him. I had security and felt safe with him in this major cancer center. That's all he did was bladder cancer, and Memorial Sloan Kettering has a whole building for urologic and prostatic cancers. So I just felt comfortable there and safe. And he said that he would. He was a man of few words, as a lot of surgeons are. So I left that appointment um, with a strategy, with a pathway. And what he needed to do first was go in and do that TURB, the scraping, just to confirm pathology. Pathology is really critical in any cancer journey, to confirm that that's the correct cell that they're dealing with, so then they know how to treat it. Now they check your DNA and genetic factors, and I've had, now 21 years later, I've had Sloan and other people analyze the tumor tissue itself for the correct treatment. So they've gone a long way with it. But I remember in the infancy of my cancer journey, in the early parts of it, just feeling glad that I was down at Sloan, but also still trying to get used to the concept that I was now in the cancer space, and it wasn't going to be easy. And I didn't know yet what the surgery would be, because we were going to go, he was going to first do the diagnosis, confirm it, and then I would go down and we would have face-to-face on what, and I would speak with two surgeons who happened to be husband and wife that both did a radical cystectomy, prostatectomy on me. I don't even know if I said that right. But again, I don't know about you, but entering this new world of unknowns and uncertainty and just fear, grappling with fear, dealing with it, still learning how to process being in a place of the unknown. And EHS, a program I like, Emotionally Healthy Spirituality, talks about the confusing in between. Like, I didn't have a strategy yet and I didn't know what would happen, but just prayerfully saying, okay, God, I try to surrender it to you, trying to find the right people, trying to handle people coming at me with talking about this cancer journey I was now on. You know, some people were avoided talking about it with me. Some people gave me incredible hope, which, you know, I don't know, maybe it was false hope, but just kind of speaking that everything would be fine. And then other people just kind of, a phrase I like, sat in the dirt with me. And that's something to talk about at a future one, is how do we respond to people as they go through the cancer journey. And I'm in the camp right now where I try to sit in the dirt with people and just listen and try to relate to them and to what they're feeling. So anyway, so I'll pick it up tomorrow, and I'm about to go in and get a scraping done. It's an outpatient procedure, so I was home the same day, and then a week later I went back to get the confirmation on the pathology, which it was the high-grade bladder cancer, and then find out what the surgery would be, which was a big surgery for me. Okay, be blessed. Thank you for listening. Bye.